Hello, my name is Brandon Herman. The devices I'm talking about today are the diaphragm and the cervical cap. Um, there are a few of what are known as barrier methods, so they're basically a contraceptive that protect against pregnancy by preventing the sperm from entering the woman's reproductive tract so that they can't fertilize the ovum. Both of them were among the earliest methods of contraception in the country. They were introduced by Margaret Sanger in the early 1900s. They don't really involve any male decision making because it's the woman who's having it inserted inside of her. It's 100% up to the woman whether or not she wants to have it. These methods are effective at preventing pregnancy, but actually they're not really considered useful in preventing the transmissions of STIs. In fact, some evidence suggests that irritations in the vagina are caused by the spermicide or latex that can actually make the transmission of STIs a lot easier, especially in high-risk populations. These devices can be short-term and long-term, I guess. The use life can be from 6 months to 2 years with proper care and storage. Without proper care and storage, the woman could always go buy a new diaphragm or cervical cap, which are not very costly. The diaphragm generally costs about $25 to $75, and the cervical cap, I believe the most common is the fem cap, costs generally $60 to $75. For both, in order to get the prescription, you need to see a healthcare professional for proper fitting, which generally costs about $50 to $200. The prescription can last about 2 years, with the diaphragm costing about $3 to $11 a month, and the cervical cap costing about $5 to $11 a month. I would say it's unique because some of the few contraceptive methods that are just inserted into the woman's vagina and actually create a barrier that covers the cervix, unlike the sponge that just creates just a barrier. It's just simply a barrier. It's also unique because they require spermicide in order to be effective. The diaphragm is a flexible ring with latex or silicone membrane. This is it right here. So, sorry about the light, by the way. So, it's a flexible ring with a latex or silicone membrane that's inserted into the vagina. It forms a shallow cup that, rests around the cervix, and it's held snugly in place by the pubic bone. Before inserting, you have to apply spermicide around the circumference of the ring, and you can put it in the vagina up to 2 hours before intercourse. So in the picture, I have a woman who has put spermicide on the diaphragm and inserted it, and so you can see it's resting right under the cervix. On the other side of this paper, I have the cervical cap, which is basically the very same, almost the same in function, except it fits much more snug over the cervix. It creates it covers, instead of resting on the cervix, it actually covers it. It can provide up to 48 hours of protection, so it can be inserted up to 2 days before intercourse. So yeah, that's a cervical cap, and again, that is the diaphragm. So overall, the contraceptive effectiveness is about the same when used perfectly, although neither is considered to be effective without the addition of spermicide prior to insertion. I would say that they're only somewhat effective because the failure rate is higher than many of the other available methods, and it's significantly higher for women who have given birth previously. If you haven't given birth, then it can be a little bit more effective because only 6 to 9% of women who use the diaphragms or cervical caps correctly will become pregnant within 1 year. So that's pretty good percentage, not as good as others. Advantages of both diaphragm and cervical cap are that they don't require any male involvement in the decision, so it's pretty good. The diaphragm can actually protect against cervical abnormalities and cancer, so that's really good. A big advantage of the cervical cap is that it can protect you for up to 48 hours, so there's less maintenance. I would say the disadvantages outweigh the advantages, though. The spermicide and latex can cause skin irritation, like I said earlier, which makes the transmission of STIs a lot easier. And while using the diaphragm, there is an increased risk for female UTIs. Also, if you leave the cervical cap in for more than 48 hours, you could possibly induce toxic shock syndrome, which is not good. You don't want that. If a friend asked me if they should use this, I would say only if they use a male or female condom in combination with the diaphragm or the cervical cap. This is the best way to maximize effectiveness. Also, just to not use the devices without spermicide. That's basically pointless without spermicide. I would say just be very sure to insert the devices correctly every time before intercourse. Also, don't insert too long before intercourse and keep them in for up to 6 hours after the intercourse. That's the best way to maximize effectiveness. Anyways, thank you.